From the NewsChannel 5 network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. Another great topic for you. I know we are going to learn a lot over the next hour. And as always, we are taking your calls. The topic tonight, non-surgical facial rejuvenation. I got that topic and I said, well, what is that? Well, we're going to learn what it is. We have Dr. Dan Hatef here with us tonight. Good evening. Thank you for joining us.
Thank you. Good evening. Thank you for having me on.
Okay, first let's just get the who, what, when, where out of the way. Tell us about your practice. What's the name of it? Where are you located? What do you do?
So it's Dan Hatef, MD. I'm located in Midtown in the hospital district. I do plastic surgery, head to toe cosmetic surgery. I do a lot of in-office facial fillers, Botox, minimally invasive lasers. I do a lot of liposuction and rhinoplasty in the hospital. I also share office space with Dr. Pat Whitworth, who's a world-renowned breast cancer surgeon, and I'm honored to help him with his breast reconstruction.
So very important. I know for women who have had breast cancer, that is a big step along their journey to get the reconstruction done and to have a good job done. You know, I mean, they've gone through so much.
Oh yeah, it's a huge honor to participate in their care, and Dr. Whitworth and the breast surgeons in town entrusting their patients to my care is really a huge honor. And not only that, but it makes me such a better cosmetic surgeon of the breast to really know how to use implants, know how to use fat grafting. It really is synergistic.
That is amazing work you do, but tonight we're going to talk about facial rejuvenation. And if you have a call, go ahead and get those calls lined up. Taylor's in the back to take them and give me the names. Numbers on the screen, 615-737+ is the number to call. So let's just start with, what is facial rejuvenation?
So facial rejuvenation is the reversal of facial aging. Facial aging begins as soon as we're born, and patients as young as their 20s are now coming in for Botox and minimally invasive lasers. Fillers, I reserve those for patients who are in their 30s and 40s. You know, about 5 years ago, the so-called mini facelift was coming into vogue and people were doing it a lot. Now I have not done a mini facelift in about 2 years. And
really?
The reason is because the fillers and the Botox give us such a nice result that I can get you halfway to where you want to be without doing any surgery. So I actually do more full facelifts now than ever, but I also do 0 mini facelifts because you can get a mini facelift with fillers and Botox.
Okay, let's talk about this, I guess, the stereotypes of plastic surgery. And we all know, and we've all done it, when somebody walks in the room or you see a star pop up on the TV screen that you haven't seen in a while and you go, whoa, what did they do? And that's probably like the worst of your field, right? You don't want people to say that. But things have evolved. There's been an ebb and flow over the decades with plastic surgery, right?
For sure. So, you know, 10 years ago, you would see a lot of poor results from facelifts, overcorrection. And so when fat grafting and fillers started to come into vogue about 5 to 10 years ago, we thought, we're done with the terrible facelift results. Now we're going to get great results because everything's going to look natural. We're going to revolumize the face. The face is deflated and it needs to be inflated. And that's true to some extent, but now we're going overboard with the fillers and that is causing these overfilled, puffy looks. And so a combination of the two is often good. I talk about restoring youthful tension. If you look at someone from the time that they're, say, 55, I'll have a patient bring in a picture of themselves 20 years ago, and you look at them when they were 30 or 35, their face is just more tense. If you look at models on TV, their soft tissues are under tension, their dermis is under tension, and so that creates a very convex surface which reflects light, and that tells our brain that's a youthful face. So when you age, your fat does deflate, that's true, your skin does loses elasticity, that's true, but really what it is the loss of that youthful tension. So you want to do precise facial filling, you've got to know the anatomy, you've got to know about the fat compartments of the face, which I helped uncover when I was in Dallas. We did some amazing anatomical research, took apart faces for 3 years and really rediscovered the anatomy of the face. And if you know that anatomy, if you know just put a little here, a little there, you can really restore what someone looked like about 5 to 7 years ago.
I want to dig into all of that because I think it's fascinating. But before we get to that, because I don't want to forget to ask this question, for folks who are watching, like, thank goodness I'm decades away or years away from, thinking about a facelift, how can you preserve your youthful look when you're still young and ward off those wrinkles and aging effects?
So Best thing to start is good skincare, because beauty is skin deep. You've got to be on a good skincare regimen, and I think that needs to start when you're a teenager. When those hormones kick in and acne starts, that's when you start your skincare regimen. And it changes at every stage of life. And if you have a good skincare regimen, that will really help. Always wear sunscreen or sunblock. Melanoma is a killer skin cancer. So I cannot emphasize enough, you've got to wear sunblock, strong sunscreen, SPF of at least 50, good moisturizer, really minimize your risk for skin cancer. And when you're doing that to not get cancer, you're going to take care of your skin to where you don't get sun damage, you don't get the melasma, you don't get the fine lines and wrinkles as quickly. So you're putting off that facelift, you're making what I do easier.
And when you say good skincare, what kind of, there are millions of products out there. We are being marketed from our friends to these days.
Yeah.
How do you know what is legitimately good?
So there are a lot of products on the market, and in my opinion, you need to change them out every season. Just like when you use something in your hair, you know your hair gets used to it.
Yes.
Your body gets used to products. So one thing I would say is you're not going to have the same regimen for 5 years straight.
Okay.
Get with a good board certified plastic surgeon, board certified dermatologist, and let them quarterback your skincare so that they can tailor it to your specific needs, because your needs are going to change as you age, as the seasons change. If you have a breakout, allergic reactions, you need someone quarterbacking your care, and you want a good esthetician and a good plastic surgeon or dermatologist quarterbacking that care. Okay,
let's jump into the office visit. If I come in and say I'm just looking a little haggard, looking a little older than I want to look, where do you start?
Well, yeah, I don't think I'd start with you. I'd wait a good 5 or 10 years. But
5 or 10? No, okay, I'll take it. I'll take that as a compliment. But where do you start with folks?
So definitely start superficially. So analyze their skin, see what kind of skin type they have. Is it oily or dry? What's the level of sun damage? Are you going to benefit just from a good skincare regimen? Some people just need a good skincare regimen. Some people need more. So if you have fine lines around your eyes, if you have the glabellar frown lines, if you have the forehead rhytids that so many people hate, then I'm going to start talking to you about Botox. Botox is going to weaken those muscles. I don't like to paralyze the muscles because it can give a weird look. It can weaken the muscles over time. So you just want to start out with a splash of Botox here and there, really decrease those fine lines. If you're lacking a little bit of volume, then you can start with a syringe or two of filler. That's not really what I'm talking about when I say the mini facelift with a filler. For that, you really need 4 to 8 syringes of filler. When you're starting out, one filler, just filling in these fine lines is perfect.
Okay. And so really just a little shot here, a little shot there, right?
That's exactly right.
That's all it takes. And what exactly happens? What does this filler do? I mean, I assume it fills something. And then how long does it last?
So that's a great question. So we're getting much better with facial fillers, both as doctors and the manufacturers. So we have fillers now that last 2 to 5 years. How long it lasts depends on where you put it in the face. So around the mouth, you're talking all the time, you're eating, that's not going to last as long. The filler's going to be moved around and metabolized more quickly. If you put it in the cheeks, lasts longer. Temples lasts not quite as long because you're always chewing that temporalis muscles, wearing it down. So it depends on where you put it in the face. It's really key to go to someone who understands the facial anatomy. I think nurse injectors are great. They often do a very good job. I'm a plastic surgeon injector. I see those muscles in the operating room every day. I've seen the facial fat compartments. There's nothing like someone who has that level of understanding and experience. So you might choose different spots to inject than maybe somebody else. Is that what you're saying? I do, yeah. When patients come to me, either they're not happy with where they're being cared for currently, or they want to try something new, they tell me I do a lot more shots and a lot less in each place. So I think that people are injecting a lot with each shot, and cannula use is becoming very popular. I use a cannula sparingly. The cannula has this role. So typically we injected fillers with a sharp needle, and so people theorize, well, if we do the filling with a blunt instrument, there'll be less bruising. It's kind of true. Okay. But the problem is that you can't be as precise with the cannula. So when I'm doing depot injections where you can inject deep into the face and you need to inject a larger amount, I think the cannula is great. But you need to have the ability to inject multiple times in multiple different areas and also multiple layers. So in the lips, I really like to use 2 different kinds of filler. One is a little bit more viscous and it just fills in like water, fills in the fine lines, but there's no structure to it. So you can't really define these filter columns nicely. You can't define the shape of the lips as well. Another thing about filling the lips is you've got to fill the lower lip more than the upper lip. A lot of times when people say, oh, she has sausage lips or they don't like her lips, really carefully look at it. You'll see typically the upper lip is the same height as the lower lip and there's the same fullness. That looks unnatural. The brain knows that's not normal. So you need to fill that lower lip a little bit more.
Very interesting.
Oftentimes patients come to me to get their fillers melted. I can actually melt fillers. I'm very accurate at doing it. So when they come to me to get their fillers melted, oftentimes what I tell them is, it's not that you need your filler melted, you need fillers in other places. So sometimes patients will think that they have sausage lips, and I'll put a little bit of the melting agent in their upper lip and a little bit of filler in their lower lip, and that balances out nicely.
Very interesting. Okay, we're already learning a lot. We're gonna have to take another quick break, or our first quick break, I should say. If you have a question, now is the time to call 615-737+. We're talking about plastic surgery tonight. Stay with us.